Hello, my name is Ben Dalton, and I am a PhD student at the University of Guelph. I work in the Neuromechanical Performance Research Lab, which is headed by Dr. Jeffrey Power, and I will be presenting today for the 2023 National Biomechanics Day. We will cover how electrical signals control our muscles and how researchers are able to measure and utilize these electrical signals to assess muscle function. But before all that, we are first gonna imagine that there's a delicious cup of coffee in front of us, and we just have to have it. But how would we tell our hands and arms what to do so we can achieve that goal? Well, when we finally decide to pick up the mug, the part of our brain that controls movement will send an electrical signal down the spinal cord and to the nerves that control our hands and our arms. This electrical signal eventually propagates along the length of the muscle, resulting in a contraction of our hands and fingers, allowing us to grab the mug, and then to our arm, allowing us to raise the mug up, which eventually will result in our happiness when we're finally able to take that first sip of the delicious coffee. But how can researchers use this electrical activity and measure it to gain information about muscle function? Well, similar to how doctors and medical professionals use EKG to measure the electrical activity of the heart, researchers are able to use something known as electromyography or EMG to measure the electrical activity of muscles. There are a few different types of EMG sensors. On the left is an example of fine wire or indwelling EMG, which involves inserting a very thin piece of metal into the belly of the muscle. And on the right is an example of surface EMG, which is much more similar to EKG electrodes because they sit on the surface of the skin above the muscles of interest. In this example, there are EMG electrodes placed on the vastus lateralis, the rectus femoris, and vastus medialis, which are three of the muscles that make up the quadriceps muscle group. Later on in this presentation, we will have a demonstration from our lab, and we will use a very similar EMG setup to the surface EMG example here. And here's an example of what an EMG signal actually looks like. Again, it is very similar to EKG, but rather than telling us what's going on inside the heart, EMG allows us to measure the levels of muscle activation under the sensors and inside the muscle. And the levels of muscle activation, it depends on the specific task being performed. For example, this study had participants come in and perform a light 20% maximal effort contraction up to a 100% maximal effort contraction. They placed EMG sensors on all of the same muscles that we talked about earlier, as well as an additional one on the vastus intermedius, which is just another muscle in the quadriceps muscle group. Because EMG is a measure of electrical activity, its units are in millivolts. And at the bottom, you can see torque or force that was produced during these contractions. Hopefully you can notice that at the 20% contractions, the EMG signal was relatively low, especially when compared to the 100% contractions, indicating that as the contraction intensity increases, so does the muscle activation necessary. This knowledge is important, especially when you're investigating muscle activity and how it's related to muscle function or muscle strength. So let's say you decide to test the efficacy of a workout plan you came up with. You're able to recruit people to come to your lab and you test their maximal muscle strength on a leg press machine. You gave them a workout routine for 8 weeks. They come back and you find that they're significantly stronger than before, which is obviously great. But if you have no other measures of muscle function, then you're not really able to tell what mechanisms led to these strength gains. But if you decide to include EMG, then when they come back, you can measure their EMG again. And if their amplitude doesn't increase, but they do get stronger, then that's a sign that their muscle became more efficient, such that for the same relative EMG amplitude, they were able to move more weight. And on the other hand, if they came back and their EMG amplitude did increase while they also got stronger, then that's an indication that your training led to a greater ability to actually activate the musculature. And now we'll head down to our lab to show you how our lab actually uses EMG. Okay, so now we'll demonstrate how our lab actually uses EMG to measure muscle activity and to assess muscle function. To do that, another PhD student in our lab, Avery here, was nice enough to help us out today. He's currently seated in a dynamometer, which is an invaluable tool for researchers in our area. It allows us to set up the chair to any specific individual based on their anatomy. We can do so by using any of these yellow levers all around the dynamometer. We are also able to test almost any muscle group. It's currently set up for the quads or the knee extensors, as that's what we will be demonstrating today. But you're also able to change out the joint attachment. This is a shoulder attachment, for example, but again, you can test almost any muscle group. And of course, he has EMG set up today. So we have some set up on his vastus medialis, his vastus lateralis, and his rectus femoris. And those are three of the major muscles in the quadriceps muscle group. And we do that, we look at multiple muscles so that we can get a better picture of the muscle group as a whole, rather than looking at just one individual muscle. And we'll look at different contraction intensities and how they're related to EMG today. We'll first start off with about a 10% contraction intensity for Mr. Avery here. I will be giving him verbal encouragement throughout the contraction, and that's basically fancy research talk for saying, I'm going to yell at Avery while he contracts. He'll slowly kick up for about 3 seconds. He'll hold at his 10% perceived maximum intensity for about 5 seconds, and I'll tell him to relax. All right, Mr. Avery, are you ready? Yep. All right, 10% in 3, 2, 1, go. And relax. Great job, sir. Okay, now that we've given Avery some rest here, we'll perform a slightly more intense contraction, about 50% of his perceived effort. And because he's giving 50%, my verbal encouragement will also be at about 50%. All right, Mr. Avery, are you ready? Yep. All right, 50%, still going up for about 3 seconds, and then we'll hold it for 5 seconds. Yep. In 3, 2, 1, go. And relax. Great job, sir. Now we'll give him a few more seconds to rest before we do 100% contraction. So now that we've given Avery more rest, he will now perform a 100% perceived effort contraction. Make sure to pay attention to the rate at which he performs his contraction, because we will be doing another one afterwards at a much faster pace. And that's just so we can look at the different rates of muscle activation across contraction styles. All right, Mr. Avery, so you're going to link it up for about 5 seconds to your 100% perceived effort. Are you ready? Yep. All right. In 3, 2, 1, go. And relax. Great job, Mr. Avery. Now that Avery has recovered from his previous 100% contraction, he is now going to perform another one. The only difference this time is that he's going to get to his 100% perceived effort much quicker. Are you ready, Avery? 100%. As fast and explosive as possible. In 3, 2, 1, go. And relax. Thank you for joining us for this National Biomechanics Day presentation. Hopefully you have a better understanding of muscle activity and how it is related to muscle force production. And have a great rest of your day.